sorry about the technical difficulties, but we'll go ahead and get this started, and hopefully the others will be able to join us when we have the webinar again tomorrow morning. So I'm Jill Brown, Director of Nutrition Education at Interfaith Food Shuttle, and we're going to start our year off in 2017 with the first quarterly satellite webinar. This webinar has a lot of information that is new that we're bringing to 2017, and then there'll be some things that we'll be rolling out over the next few months as we transition over to electronic surveys. So thank you for your patience and for attending this webinar, and we'll go ahead and get started. The agenda for today will be some staff updates, and then we will also be looking at a new document that we have for training, which would be helpful if you're training new staff or if you just need a refresher. It's kind of a nice little checklist of things to go through and make sure that you have a full sense of what we're doing. And then we'll talk about the survey changes. And so we're going to have an e-survey implementation process over the next 6 months, and we'll give you a lot of support throughout this process and a lot of options to consider as we move forward. Before we jump into our agenda, I want to make sure that you have made a note of the webinars that are scheduled for 2017. So the next 3 quarterly webinars will occur on March 7th, June 6th, and then September 7th. As we look into March and maybe even June, we will start taking a look at our goals for the next fiscal year, which will be 2018. And that starts July 1st, 2017 and runs through June 30th, 2018. So we will start kind of taking a look at that, and we will walk you through that process and give you an idea of what you've done to date and what types of programming you have been running and what that looks like, and help you set some goals for the next year. So let's jump into our agenda here. And we're going to first look at some staff changing. So as I mentioned back probably in December or November even, we had some staff changes, and Abby was the site contact who took over for Catherine Moser, who went to UNC School of Public Health. And Abby took a different opportunity within the Interfaith Food Shuttle, which was great for her. And so what we've done is put Elizabeth Weeks in a position to be helping you with your day-to-day operations and the orders for curriculum tours, gift cards, any troubleshooting, any issues with volunteers, any other questions that you could have related to nuances of programming. A lot of those things she can answer. And then she may also be conducting some quarterly webinars and training webinars as well. I will continue in my role of assisting with onboarding new satellite partners. And we have a number of collaboratives that, for example, out in Western North Carolina, where we have the dietetic interns from Western Carolina, that we're partnering with agencies out in that area. And there's, if you're one of those agencies, there's more to come about that, but there's a really great opportunity to create some collaboration to help you guys with capacity building as we, you know, move forward with our programming year. So a lot of those types of conversations and meetings are things that I work on. And then of course we always have grant-funded expansion opportunities from time to time, and a lot of times I will take care of those in quarterly webinars. So if you cannot reach Elizabeth, you certainly can reach out to me and vice versa, and between the two of us we'll try to take care of everything you need. So let's look at a new training guide. I've included this as a handout in the webinar, so it is an attachment that you can download, and it is available on the website. And it is under Training Step 2. It is the first, if you click on Step 2 Training tab on the left, you will see this, this document that you can download and use. And so you can see from the screen it's got some flow charts and it's got some timelines, and then just some checklists for things to be looking at if you're going to be implementing Cooking Matters at the store or Cooking Matters. If you have not taken the opportunity to download the timelines, I would really encourage you to do so. It's one of the first things that we added when I came in 2012, because satellite partners really needed some sort of guidance on how to, you know, if they know what date they want to run class, how to sort of back up from that and know that all the pieces are in place. So all of the timelines have hyperlinks for the different locations that the documents are available on the blog. So if you just download those onto your desktop, have them handy, and you're getting ready to schedule a Cookie Matters at the Store class, you just pull up the timeline, click on any of the links, and then you'll have the documents that you need. And of course, we're always moving things around, so we're always updating those timelines. So just make sure that you have the most current version. But those are a really helpful tool to kind of keep you on track as far as ordering materials. And next, on to survey changes, which is the big topic for this webinar. Share Our Strength has done a lot of work over the last year working to an electronic format, and we'll talk a little bit more about this and how it's going to work. The purpose of this webinar is not to train you on how to do electronic surveys. It is simply just to give you an overview of what the changes are and then a timeline of how this is going to be implemented before we go live on July 1st, 2017, okay? So as we get started here, the current system we have has the pre and post course surveys, which you're used to. If you're doing only CMATs, that would just be an in-store survey. And then mailing those to us, we process them. We send that paperwork to Share Our Strength after we've closed out your courses. And then Share Our Strength can take anywhere from weeks to months, actually, to scan all of those surveys. And then they would give us a data file that they gave to us quarterly, which didn't necessarily reflect the quarter's worth of work. So if it was third quarter of the year, it could have data that was much earlier than that or much older than that, depending on when they got all the surveys scanned. So it wasn't really very helpful if you were looking to really pinpoint activity in a very specific quarter or with a very specific population. And so we would get those quarterly files, and then we'd transport that data into a template to be able to address the desired outcomes. And so what that looked like was we would get a bunch of zeros and ones, like you can see on this this snip here, and that basically translated into all of your demographic information. And so we could tell how many were male, female, what age, what the percentage of change was for the different questions that are on the survey. If you are not familiar with this form, it definitely would be worth your time to reach out to Elizabeth and ask her for maybe the last 12 months or even the last 6 months worth of your activity and see what your demographic looks like. So you've got the demographic information, all the behavior change information, and then there's even a third tab not represented on the slide, which has all of the quotes and information that participants wrote in. And so that gives you a lot of really good material that you can use to promote your programs and push out on Facebook and Instagram and so forth, or to use in materials that you would use for recruiting participants, because you can say, 85% of participants, reported eating more fruits and vegetables after attending a class, for example. And so those are the kinds of reports that we generate for anybody that needs them. That's the beauty of working with a national partner, is that we have the ability to have them do a lot of the legwork and then flesh out all of the behavior change information for us and demographic information that we might need for SNAP-Ed and so forth. So all of that process took months before. And so now we have a much more streamlined option where we have the pre and post surveys. The data will be uploaded immediately after a course or tour. So literally you will wrap up a 6-week course the very next day or even later that day. You can upload all of your surveys, and then that data is immediately available for these same reports. And so we're going to be able to get data much quicker. It used to be that I would have to have when I started in 2012, we'd have to have maybe 4 weeks or so for Share Our Strength to give us the data. Then we moved to us having quarterly reports, which was great, but it still took us, a few days, and it may or may not have the exact date range that you're looking for, say, a grant report that you're doing for yourselves. But now we will literally have almost everything in real time and be able to upload all of that information. That being said, it's, we have some surveys that are still going to be in paper form and some that are electronic. So we're going to talk about that a little bit. So we're going to focus really on this first area, the pre and post surveys, and then uploading the data to the courses and tours. So looking at the surveys that are currently available, what will be an electronic only form is Cookie Matters Parents, Cookie Matters Adults, and these are in Spanish and English, by the way. Cookie Matters Families, and Cooking Matters for Child Care Professionals, and then the Cooking Matters at the store for both adults and WIC are all available in electronic format. What's still in paper form is Cooking Matters Kids and Cooking Matters Teens. Now, Cooking Matters Families, I put an asterisk next to that, and the kids, because that is an area where right now they have the electronic portion for families just for the parent portion, but they do not have the survey for kids electronic, and therefore currently the way it stands, if we did Cooking Matters Families and did the surveys, we would lose any behavior change responses from the kids because it's not part of the survey. So we're still working with Share Our Strength to try and figure out how to make this work, and I suspect it won't be too much longer before the kids and the teen surveys will be electronic, and probably this entire challenge will be mitigated. But for now, we're just still kind of working with them on what that's going to look like. So how are we going to capture this data? There's two ways. One is an app from Qualtrics, and that can be downloaded to a tablet or an iPhone, or there are links for each specific survey that can be used on a computer. So it can be, all the data can be entered on a computer. Now, I've included a link here at the bottom of the screen, and again, this webinar will be recorded and posted probably tomorrow, so you'll have all of this information. But on the satellite blog, there's a link at the very bottom left that says, I think it says preview link, and in that we have included everything that we have done for our volunteers. Now, what we did in terms of logistics and rolling this out with our volunteers for the courses that we run may be a bit different than how we would put together training materials for satellites. So I don't want you to think these are your training materials because we will still be developing those, and they'll be more specific and take care of all the nuances of the satellite partnership, whereas the materials we have here were really geared toward training our volunteers. However, they are a really good starting place for you to think about how you might implement this. For example, I talked with one satellite partner who runs just Cookie Matters at the store, and we went through sort of some of the changes with the electronic surveys, and she really felt that, to be honest, hauling a bunch of tablets through the grocery store didn't really sound like a good idea to her, and I tend to agree. And so she's going to continue to collect all of the survey data and the demographic data in paper form, and then she's going to go ahead and just enter that or have an intern enter that on the web links because it just seemed to her logistically more challenging. You're already carrying around baskets and participant guides and the incentives and all the things that you carry throughout the store when you're doing the tour. She didn't want to add tablets to that and felt like it might just be a little bit too challenging, and there's only a couple questions on the grocery store surveys versus the 6-week courses have a lot more material, plus they have a pre and post format. So for grocery store tours, she felt like really that would be the best fit. And so we're going to talk about sort of what some of your options are that you can begin to think about and figure out, what might be the best fit for you. And of course, we'll be providing a lot of support throughout this process. So option one, just kind of jumping in here, is to continue with paper surveys long after July 1st, which is when everything has to be electronic in some way, except for the kids and teens. You could continue to implement paper surveys and then either have an intern or a staff member enter that participant data into the various links for Cookie Matters Parents, Adults, Families, Child Care Professionals, and the grocery store tours. This is something obviously that you'd have to think about your internal your internal considerations, as well as your capacity to be able to do that. We tend to have interns from the universities, so this is a good opportunity for them to get familiar with assessment, but also provide a service for us, because to be honest, from January 1st to July 1st, when you send us paper surveys, they're going to be entering all of those. For us, so that we can make sure that everything is electronic. But after July 1st, that responsibility would shift to the satellite partners. So be thinking about ways that perhaps you could get a volunteer or maybe an intern that could enter that participant data if you really feel like sticking with paper surveys is the best way to go for you. Option 2 would be to use either tablets or an iPhone app for the whole class for these particular courses. So some of my concerns about the implementation of the tablets and other various technology is that it adds a whole nother level of challenge with our participants that may have challenges going through the survey as it is. And the other thing that I wanted to think about was having some people on their iPhones and some people on tablets, trying to get through the survey, I felt like would take just too much time. So for us, what we have decided to do is that we are exclusively using tablets in 6-week courses, and we are exclusively using paper in the grocery store tours. And then, of course, that paper will get entered when they get back to the office. We didn't want to mix in people's iPhones if they have them, or maybe a laptop, because it just seemed like too much technology, and all the nuances are slightly different. We wanted to be able to have everybody working on the same survey, going through all of the information together until they get to the survey part, and then really let them go and kind of fill out all the survey. But there's initial information about demographics, their zip code, for example, their initials, the course code, all of those things we wanted to really go through as a group. And then once we got to the survey questions, really let them loose and let them go ahead and finish that at their own pace, but everybody working off of the same tablets. So that's just what we decided worked best for us right now. And as we, work through all the kinks, we're just in the middle of starting January classes, so we're kind of coming across different things that we need to consider, and hopefully we'll have all those kinks worked out before we work with you guys later in February or March to implement the electronic versions. So option 3, which is a very viable option as well, is to use as many tablets as you have for the electronic surveys, and then have the remainder of the class fill out paper surveys that then get entered into the links found on the blog once you get back to your office. So you could have some electronic and then some working off of paper, just to be able to get through the whole survey process, knowing that you'd have less you'd have to enter than option 1, but you'd have people working on sort of 2 different methods, and that really kind of depends on how you want to work with your volunteers around these surveys. So we created some resources for our volunteers that, as I mentioned, are on that preview link that you can definitely take a look at. I don't expect you to go in and go through full training, because to be honest, they're nuanced for our volunteers and how we're implementing courses, and it may not make sense for you. But what we did was we created particularly for the 6-week courses, we created this first day of class so that we're writing on this card whose name it is, have the course code already filled in, and then we're assigning them initials. And I know that sounds kind of silly, but if they have maybe 4 initials to their name, or we know we have multiple initials, we wanted to create some consistency. And so what we've done is come up with a system where if it's Jill Ann Brown, who's the participant, we'd put JAB. But if we also had Jack Aaron Baldwin there also, we would have JABX, and then there would be JAB for me. So we tried to come up with a way that we could limit and have the default be 3 letters for their initials, and then if we had duplicates, add an X or a Y or a Z on the end. What we want to do is make sure that we write that down, because then when they come back to do the post-course survey, they have to enter those same 3 initials. So if it's a participant who has, 4 names, or they switch names partway through the class, which certainly could happen, and they changed it up, the pre and post will not match. So we want to make sure it's written down and they're basically assigned their initials, and then that way when they come back, on the back side of the card it has their initials, we've identified which curriculum it is, and then the month it ended and their attendance, and everyone will have signed the waiver. It actually is not a yes or no question when you get into the survey, but the yes or no was there just for our own needs, to remind ourselves that we needed to make sure we had an accounting of all the waivers. And the other thing that's in here that we're kind of playing around with is the zip code. And so as you probably well know, a lot of time the participants that we're working with, they may be staying with one relative for a couple weeks, and maybe they move on to a different relative because that didn't work out for another couple weeks, and their zip code could change. And so we've adapted this welcome and congratulations cards to include the zip code. So whatever zip code they have when they start class 1 is the zip code that they would enter in class 6, even if they moved, or even if they are staying with a different relative or a different shelter, or whatever their situation may have changed. And the reason is because what happens is the initials and the zip code create a unique ID, and that's what matches the pre and post course. And again, all of this will be explained in training. I'm just trying to let you know kind of why we have some of these resources that we have. And we have videos for adults and parents, for families, and then also for the grocery store tours. But again, I'm not expecting you to go through all this and digest it. Just, you might want to take a look and just see how we did it, and how we set up our volunteer training as an idea for how you may also do the same. The other option is that you can always redirect your volunteers to our volunteer training blog, and we'll talk about that more as we start kind of rolling this out. So here's the preview link. Feel free to click on it, take a look at it, but again, don't spend a lot of time getting trained at this point. So here's what the timeline is going to look at. What we'd like for satellite partners to do at this point is to do an internal assessment and figure out, what your capacity is. Do you have resources available that you could purchase tablets? They're about $50 from Amazon. The cases are somewhere between 6 and 7. And then of course you may need a surge protector or something to kind of plug everything in. And we ended up doing 36 for us, just to kind of figure out if that was going to be enough. We also do have funds available to distribute tablets to satellites. So while you guys are figuring out whether or not you have any funding available to do this, or how you're going to manage the paper versus electronic, and who's going to enter this information and so forth, we're going to be working through the form that many of you filled out. It was a technology survey that was done back in the fall to let us know if you had any capacity for purchasing tablets, or how many you felt like you probably would need. And so we'll be looking through that. We will compare that to each satellite partner's volume to determine, which ones will be able to get the tablets. We unfortunately are not going to be able to buy full sets of tablets for probably anybody, but we want to make sure that we provide you as much technology as we can, and we have some funding to do just that. And so we will be putting together some webinar training, some videos and documents that will be shared with you mid-February, no later than mid-March, but we're shooting for mid-February, early March, so that you have all of March to train your volunteers and staff on whatever new process you decide works for you. And then we'll touch base in probably mid-May, troubleshoot, let you know some of the things we've learned, have an opportunity for satellites to share some of the things they've learned or processes that they've implemented, so that you'll already be in the process probably a month and a half of beginning e-surveys, because those would start in April and run through June. That gives you 3 months to really work out a lot of the kinks and kind of figure out what works. And then come July 1st, we have to be completely live with 100% no paper. Again, except for kids and teens, unless they end up making those electronic between now and July, which would not surprise me, so we may have to kind of tweak some of our trainings partway in. But that's what we're expecting that satellites will be working on while we're working on all the support pieces. And so we're optimistic about some of the trainings and videos that we're going to be able to put together, some fast facts documents, and those will all, you know, they're already in progress, and we'll kind of get those all launched to you as soon as possible. So it will be really important between now and July to make every effort to attend the quarterly webinars, because there could be information related to the e-survey process on those, as well as the specific training webinars, which will certainly be required so that everybody's on the same page. What will happen after July 1st is that if we receive paper for the surveys that are in an electronic format, we'll send that back to you and give you an opportunity to enter all of that information, and then kind of just stay in touch and make sure that you know, you don't have any questions about that process or need any additional assistance from us. And then that is it. So I wanted to open it up to some questions, and I am going to unmute everybody, and let me know if you have any questions right now. Clear as mud?
Looks good.
Okay. So stay tuned for more communications then from Elizabeth about the upcoming webinar trainings and videos that we will have. Like I said, this webinar will be recorded tomorrow, and it will be reposted on our blog. And so if you need to refer back to it just to kind of get a sense of the timeline, feel free. Otherwise, we're really excited about this process. It's going to be very much a game changer for us, for you guys, so that you have more data and that's more current. And so I think it's going to be really helpful. We just have a few growing pains, but we will certainly work through those and be able to come out at the end and be okay. Any last questions before we end the webinar?
No, thank you.
Okay, thank you guys for being patient, and I apologize again about the technical difficulties, and I hope you guys have a great rest of your week.